Okay, so let me see if this is going to have me do the speaker view here. Nope, it likes you, Christine. Okay, I'll just go back here. All right. So just to tell you a little bit about me and how I got into this field. So I worked as a surgeon, and I'm board certified in general surgery and plastic surgery. And I worked as a plastic surgeon for about 12 years. And I had a really special interest in working with breast cancer patients. And that's because I lost my mom, to breast cancer. When I first started my practice, there was kind of like this amazing convergence of things that were happening. And one was, my mom had stage 1 disease, so we thought she was going to do fine. And then she ended up getting metastatic breast cancer to her femur. And she just didn't want to do any treatments or anything. And she died about 9 months later. So that really rocked my world, because she did everything that Western medicine told her to do. And, her outcome wasn't good. So then I started looking at my patients, and I was noticing that as time was progressing, they became younger and younger and younger. And when I operated on my first patient in her 20s, I mean, it was absolutely devastating to me. I was just like, this should not be happening, to people this young. So I went through the medical research, really looking to see, what, if anything, women could do to help to lower the risk. Because at the time we didn't know anything, we were just like getting mammograms and that's it.
Breast reconstruction, is that what you were doing?
I did breast reconstruction. So, as I said, at the time, we didn't know. They just told people to go get mammograms, and that's the best thing we can do to try to catch it early and a more treatable phase. But I felt like, okay, every time you go in for a mammogram, it felt like a game of Russian roulette. Like what year is it going to get me? And it's completely disempowering. There was no information about things that you could do to help to lower your risk. So I went through the medical research, and this is like 25 years ago, just looking, like I said, for anything I could find that had an association. And even way back then, I found thousands of studies, showing exactly why we have a breast cancer epidemic, and prostate and colon cancer. They're very similar tumors, and also just ill health in general. And of course, it makes common sense. It's all mostly diet and lifestyle, related. Now, when I went through medical school, and I did, a full residency in general surgery and plastic surgery, so I did 15 years of school, after high school, I didn't have a single course in nutrition. I mean, not one. And we didn't think there was any connection between the mind and the body. I mean, it was ridiculous. So I truly learned nothing about health or how to create health when I was through all my medical training. I only learned how to treat diseases, or, suppress the symptoms, or, cut things out, when I was, a general surgeon in particular. So then during this time, the other thing that happened was insurance companies decided to stop paying for breast reconstruction. So, we used to have to send letters to insurance companies and ask permission, to do the operation. And so then I got a letter one day saying, we're not going to pay for breast reconstruction on your 34-year-old patient because it's on an organ with no function. I was like, what? Anyway, it was a very long story to condense, but I got just enraged. And so I decided to start a national kind of campaign to pass legislation to make it mandatory that insurance companies pay for breast reconstruction. So President Clinton was in office at that time. And again, making an extremely long story short, it was a 5-year campaign. I met with President Clinton multiple times and Hillary, and we ended up getting the legislation passed. It was, added onto the budget bill in the nth hour. But anyway, there is now a federal law that says all women can have breast reconstruction available to them, all stages of the operations, and including symmetry operations, so that they match. It's like, what a concept. So after that passed, I was thinking, okay, that this is something that really needed to be done, but it was also that, we have a bigger problem, and that problem is, the breast cancer epidemic. So I really, focused on looking at what we could do as preventative measures. And this is, add another one here. So I ended up writing this book. It's called Waking the Warrior Goddess, and the subtitle is Dr. Christine Horner's Program to Protect Against and Fight Breast Cancer. So it's all the things that I found in the medical research that had an influence. So either the things you need to avoid or the things you need to favor to lower your risk. And I found that everything that has an influence on breast cancer, it's not unique to breast cancer. It's really like if you do all the things that we found that lower your risk of breast cancer, it's going to lower your risk of every, kind of chronic disease, too. And it's just kind of a recipe for how do you, create good health. So I, actually got trained in a traditional system of medicine called Ayurveda. That's where yoga and meditation and all those kinds of techniques come from. And I got introduced to it and learned how to do transcendental meditation. And so when I learned meditation, it had such a profound effect. Then I realized I wanted to learn more about it, because this is a system of medicine that really understands health, like that traditional Chinese medicine, to really understand how to create health. And that's, their purpose with it, rather than our Western disease care, system. So when I got trained in that, I just thought, my God, there's so many simple things that people can do that have such a dramatic effect on improving health, and they just don't know. So I ended up pitching the television stations. I lived in Cincinnati, Ohio at the time, but I pitched the television stations to have maybe the on-air doctor talking about complementary and alternative medicine rather than pharmaceutical medicines. So they said yes. And so that actually started a whole new career. I ended up leaving my practice and then doing television for the last 20 years, and had my own radio show and wrote for national magazines, columns for magazines, and then have written a couple of award-winning books as well. I got introduced to thermal imaging probably 20 some odd years ago. And at the time, it was mostly kind of focused on doing breast thermal imaging, but I thought, oh my God, this is like such an amazing technology, because it can be used as a preventative tool. And we don't have any other preventative tools. All the other imaging that we use, the ultrasounds, the MRI scans, the mammograms, even CAT scans, these are all anatomical tests that are looking for breast cancer, and they don't have an ability to find imbalances in the body before they, convert into breast cancer, but thermal imaging can. And so that's the thing that got me so excited about it. So about 7 years ago, I decided that I wanted to start working as a physician interpreter for interpreting the thermal images. And I researched all the different companies and found by far the best company, which is in Florida. But I got trained in that, and I've been doing that, like I said, for about 7 years now. And so as my job, I actually, got trained then in all the areas of the body and the things that we can see, with thermal imaging that I had no awareness of, before. And so my passion for this technology really grew because I got a much more sophisticated understanding of all the different things that we potentially can see with thermal imaging, and what a phenomenal preventative tool that it can be, way beyond, just looking at the breasts. So I'm going to have everybody mute themselves here. I can try to do it too. Let's see. I don't normally do Zoom calls like this either. So anyway, there's like, if you just move your cursor on the left lower hand, there's a mute button, a microphone. If you could do that, that would be great. Okay, so I'm going to go ahead and screen share here with the PowerPoint. All right, so this is a an image, a thermal image, and people get extremely confused about what we're actually seeing with thermal imaging. And that's because the information that we get from it is completely unique. There's no other test that supplies this information. And it's considered a physiological test, not an anatomical test. And that's what all the other tests are, actually anatomical tests. So I want to spend a little bit of time just kind of distinguishing the difference between a physiological test and an anatomical test. So if you look at this image, you could say, well, it looks anatomically like a human head, but actually it's all an illusion. So what the infrared camera does, kind of at the most simplistic level, is it is measuring the surface temperature of the skin. That's all that it does, is it measures the surface temperature of the skin. Then the software program converts each temperature into a color. So that's what we're seeing, here along the side of the screen there, this kind of spectrum. This is a different temperature. So the coldest temperature is kind of this dark purple to black. The hottest temperatures are red, and then white is the hottest temperature. So as I said, the software is assigning a color to all the different temperatures. And then what it does is that creates the image that we're looking on a computer screen. As I said, the darkest temperature is going to be black. So the nose, this is kind of a typical appearance for a head, is going to be so cold it looks black. The cheeks are going to look cool like that. And then the inner eye area is going to be, darker there. Now, the reason that thermal imaging is something that is can be a very valuable medical tool is because there's this reaction that happens with our nervous system that innervates the skin. So it's actually called the sympathetic nervous system, and it has a connection to the skin. And so anytime we have an underlying change, like a dysfunction, an imbalance, disease, infections, injuries, anything like that, through the sympathetic nervous system, is going to cause the overlying skin temperature to change. Now, the human body is remarkably symmetrical. So we're looking to see, does one side match the other side? So we can kind of go through here going, yes, yes, yes. And then we get down here and we see where there's a heat pattern on the left side of the mouth that we don't see on the right. So that, as a person who does the interpretations, that's what's going to draw my attention to that area and let me know that there's something going on there that needs attention. Now the camera is very small here, and so it's done on the computerized screen here that's converted. You can't wear any clothes for it, because we're measuring the surface temperature of the skin. I let people wear their underwear in there, but otherwise we have to have the skin exposed to be able to measure that surface temperature. Now, here's a great example of thermal imaging as a physiological test. So this guy is a thermographer in Europe, and he took an image of himself, and then he drank a massive amount of alcohol, and then he took a picture of himself the next day. So in 24 hours, he had this huge, change thermographically, to his body. So these patterns are actually called mottling patterns. So it's spelled M-O-T-T-L-I-N-G. They represent inflammation in the body. So this is a really amazing, thing that thermal imaging can do, is where it can actually assess how much inflammation we have in the body. We don't have any other tests that can do that. There's blood tests that we can do looking for inflammatory markers, but they're way, way delayed. This was within 24 hours, we can see this massive increase in inflammation. Now, there's many different things that can cause mottling patterns. So in this instance, any kind of toxicity from alcohol to cigarette smoking, chemotherapy. If you have allergies, sometimes these will show up. If you have digestive issues like leaky gut, sometimes we see these patterns just over the abdomen and no other place on the body, letting us know that it's, originating as a digestive, problem. Autoimmune diseases can cause them too. So whenever somebody has these patterns, then it's important for me to kind of investigate with them, okay, what's the most likely source So we know exactly what we need to do to reverse those patterns. As you know, inflammation is something that really drives all the different chronic diseases, from dementia to heart disease to breast cancers. And so we really want to minimize inflammation in the body, and thermal imaging allows a non-invasive, completely harmless way for us to be able to do that. Okay.
Can I ask a quick question?
Sure.
When I had breast thermography done several years ago now, I was told that Dr. Kane did not, what he looked at was not the colored photograph that I saw being taken, that there was a black and white version of
Yes,
it. And,
I'll show you all that. We'll get to
okay.
that. Yeah.
Okay.
All right, so now all the other tests that we have are considered anatomical tests. So these are very different. As you see, when you look at these, they look very different than the thermal image that we have. So the left upper square is an ultrasound. The head is an MRI scan. The abdomen is a CAT scan. The breast is a mammogram. So each one of these tests, what they do is they take a cross section of the human body and they're looking at the underlying architecture. So these tests will only detect something once there is a structural change to the body. So in other words, they will only tell you about something that you already have. You know, thermal imaging, on the other hand, can be used as a preventative tool. So as I told you, I'm certified in Ayurveda. Ayurveda and traditional Chinese medicine uses something called pulse diagnosis. This is very different than what Western medicine uses the pulse, for. We're not just, feeling the number of beats, per minute. We're getting a lot more information from that. So amazingly, here these systems of medicine are thousands and thousands of years old. And they're actually based in quantum physics. So in quantum physics, we know that at the finest level of life, there's these little vibrating strings. That's called the superstring theory. And the vibrations are something that actually set up a vibration in all the different tissues and cells in our body. So as the blood flows through the body, it comes in contact with every cell, every tissue. It picks up that vibration, and that can actually be felt in the pulse. And it gives us a lot of information about what's going on with the different organ systems and so forth in the body. Now, both of those systems recognize 6 stages of disease. It isn't until the 5th stage where you get a structural change to the body that can be picked up by a Western medical test. The whole idea with these, systems of medicine are to prevent, disease and to enhance health. So we are able to pick up imbalances at these early stages before there's a structural change to the body. And that's at a stage where they are easily reversible with simple diet and lifestyle techniques. So I liken thermal imaging to pulse diagnosis. With pulse diagnosis, we're feeling the imbalances. With thermal imaging, we're seeing the imbalances. Now, not everything is going to cause a thermal pattern. And you think of it logically, because we're measuring the surface temperature of the skin, anything that's close to the surface temperature of the skin is most likely going to cause a thermal pattern if there's an issue with it. The further away we get from the skin, the less likely that if there's a dysfunction that is going to actually cause the skin temperature to change. So once we get into the chest cavity, kind of deep into the chest cavity, or in the deep into the abdominal cavity, then generally we don't see things, causing a change in the surface temperature, like the uterus or the ovaries or so forth. They normally do not. But anything, head and neck, all the extremities, the breasts, and all these things are extremely superficial. And so we get really great information from it. And this is just kind of a short list of the things that, we see. There's a lot of other things that we can, see in addition to this. Now, when I do an interpretation, I know what the normal pattern should look like for each area of the body. And then I'm comparing each person's images to what I knew it to be normal. So the normal head and neck, as I showed you previously, the nose is so cold, it looks black. The cheeks are symmetrically cool, and then the inner eye area is going to be warm. If we look at this person, we can see where there's these vertical patterns of heat patterns that we're seeing, as well as heat patterns under the eyes. So this corresponds to inflammation in the sinuses. So the frontal sinuses are, in this area. Kind of a fascinating thing that happens because thermal imaging is a physiological test and not an anatomical test, is that sometimes what's causing the overlying skin temperature to change is actually not anatomically directly below that. So a great example of it are the maxillary sinuses. So the maxillary sinuses are encased in bone in the cheeks. And so bone does not transmit heat very well, but where it will go is under the eyes. So whenever we see heat patterns under the eyes like this, we know that that is inflammation in the maxillary sinuses. So the maxillary sinuses are the ones that are most involved if you have a head cold, if you've got allergies, if you have, sinus infections. And lots of times I'll see these patterns in people who have no awareness, that they've got inflammation in their sinuses. They don't have any symptoms. This is another great thing about thermal imaging, is that we oftentimes see things before somebody has symptoms, so we can kind of alert them to what's going on. And again, the earlier we can catch things, the easier it is to reverse them and prevent it from going on to developing a disease. Thermal imaging is phenomenal for dental issues. A very common thing that I see is that if somebody's had a root canal, they might have an infection under that root canal. And believe it or not, the dentist actually has a very hard time finding that. And because if you look in the mouth, you don't see anything. Their major tool that they use is an X-ray. And if there's no change in the bones, they're not going to see anything there. But with thermal imaging, we may see a really hot spot area, and then I know that there's clearly a tooth infection going on there. I send them back to their dentist, and then invariably the dentist finds that yes, there was an infection there that they didn't pick up any other way. Now in the side view, the external ear is going to be super cold. Anything that kind of sticks up from the surface of the body, so like the nose, the ears, they're going to be cold. Anytime we have a contour depression, it's actually going to be associated with heat. So the external ear is going to be super cold. This hot spot right there is the ear canal. And then we actually put a headband on and bobby pins to hold hair out of the way, because the hair will obscure our ability to see things that underlies it. But what we're doing with that is exposing this area, which is the TMJ. So we're able to see if there's inflammation in the TMJ. There's also another area right behind the earlobe called the mastoid process that commonly gets inflamed. And this is where all these different muscles insert, they're involved in chewing. So whenever we see the inflammation in these areas, it can explain why people sometimes have chronic headaches, neck pain. With the mastoid area being inflamed, it can cause ear symptoms like dizziness and vertigo. So again, this is something where normally the doctors can't figure it out with their normal testing, but we can see that with thermal imaging. And this is usually related to dental issues and alignment and so forth. That's treatable. Now the nose can be abnormally warm for several different reasons. If you have an active head cold, sinus infection, going on, then it can make the nose too warm. There's multiple reasons or kind of things that we can see with thermal imaging that can give us an indication that someone might have high blood pressure. So one of them is that the nose is abnormally warm. Also, if the ears, both ears are too warm, that's another sign that person has high blood pressure. Now, when I do an interpretation, it's a lot more complex than what you would think. The color scheme that we use for the images in the report is the one that I've been showing you so far. And we choose this particular, we call it a palette, because it's the one that makes the most intuitive sense, where red is hot and blue is cold. When I'm doing the interpretation, I'm actually using 6 different color palettes. So as you mentioned, the black and white, one, and then so this one in particular, we like to use because it gives us a view of the blood vessel patterns super clearly, as well as the modeling patterns. And we see it much better than we see, on this palette. There's palettes that accentuate the heat patterns. So this one, does that so we can see where the hottest spots are. This particular palette is one that accentuates both heat and cold. So if you look at the one up in the left upper quadrant there that we usually put in your report, you can see where the cheek looks green. But if you come down to the lower, middle one, you can see where there's this strip of coolness there that you cannot see up here. So this is why, a lot of times when people are reading the report, that I've given them, then they look at their images, which are going to be these, in this palette. They may look at it and go, I have no idea what in the world this woman's talking about because I can't see it. And the reason is that whatever I'm seeing, I'm not seeing with this palette. So you cannot see it with this one. I'm seeing it with one of these other, palettes here. Now on the thyroid view, obviously we're looking at the thyroid. So because thermal imaging is a physiological test, it's going to show us the kind of how things are functioning, metabolically. So if the thyroid is underactive, it's going to show up as a cold patch, over the neck. If it's overactive, it's going to show up as a hot area there. We also look at this view to see if somebody has a true infection, like around their mouth or sinuses, because if they do, it's going to drain down through the lymphatics in their neck. If they just have local irritation there and not an infection, it doesn't drain down into the neck. So it helps us to distinguish that. This is a really cool thing, I think. So thermal imaging allows us to kind of get an estimate as far as how healthy the immune system is. So there's a couple of different points. So there's one, this is the back of the neck here and the back. So right over what we call the second thoracic vertebra, or T2, this is an acupuncture point, and it has to do with the immune system. So just like, if the thyroid is underactive, it shows that it's cool. If your immune system is underactive, it's going to show up in this area as cool as well. Now there's a corresponding point right in the center of the chest. This one's a little bit more unusual, but if I see both of these in somebody, then I know that their immune system is really struggling. And so that tells us, okay, our focus is to really help to strengthen that immune system. Now, breast thermal imaging is kind of the area I think that has the most confusion, about it. And again, most of it comes from the fact that it's a physiological test and people are trying to squish it into the anatomical test box, so oftentimes people will say, well, can you do thermal imaging instead of a mammogram? And as I showed you, those anatomical tests, the ultrasound, the MRI scan, the mammogram, these are the anatomical tests looking for cancer. With thermal imaging, ideally, we don't want to look for cancer. We want to look for physiological changes in the breast that occur sometimes years before somebody would go on and develop a breast cancer. So this is a great example where this woman's got a lot of kind of increased patterns in her breast. There's many different guidelines that have been established through the years that are based on asymmetry, meaning is the pattern on one side and not on the other, the amount of heat in the pattern. So I have to do absolute temperature measurements of it to see if it qualifies as something significant or not. And we also look at the configuration of the patterns too. Now, the wonderful thing is that the breasts are extremely sensitive to diet and lifestyle, nutritional supplements, and emotions. So when I see somebody that has, an increased, when we see patterns like this, the research tells us that what it means is that this person has an increased future risk of developing breast cancer. So if we catch it in this stage, then what I do is I tell people, all right, we're going to do the full court press of diet and lifestyle. So I recommend that they get my book so that they can, read about all the things that research, shows has an association, and they get to know all the do's and don'ts. And everybody finds, certain things where they're like, oh my God, I didn't know this, and I'm the worst offender, of it. So that I'm always like, those are the things we want to focus on. Then there's,
Can I ask another quickie question?
sure.
When you do a mammogram, my understanding was they'll catch something physiologic, like a cyst that might
No.
be dead, like an old thing that
No.
that might worry you because it shows up in a mammogram, but that wouldn't show up in a thermogram because it's cold. There's no blood
Oh,
supply.
geez. Okay. Okay. Wait a minute. Sorry. Okay. So mammograms are not physiologic. They're anatomic. Thermal imaging is purely physiologic. So we're going to see these imbalances, that occur by the physiology of it. Mammograms are going to show anatomically, what's going on. But as I'm saying, what we want to do is to catch things at an early stage, because we know that diseases, all of them start as imbalances. And this allows us to pick up things at a stage where there's imbalances, going on, where they're easily reversible. So
well, the point I wanted to ask about was, I know somebody who had a biopsy because they detected this dead, like old cyst, like this old hard thing. The mammogram, it was completely false. It wasn't necessary because that test picked up this thing that was not doing anything. Her body had essentially walled it off, and it was,
well, that's a problem. It's one of the problems with mammograms. I'm not a huge fan of them because there's a lot of problems with them. They overdiagnose. They lead to unnecessary biopsies. Like 80% of all biopsies are considered unnecessary because, they're benign, so that's like an insane, number. And then also, it misses a lot. It can't be used in young women because their breasts are too dense, and there's just lots and lots of problems. But with thermal imaging, we can use it on babies. It's completely harmless, to people. So there's no, risk associated with that, and there's no compression, that's associated with that either. But what I wanted to show with this is that with this woman, for example, what we did was to have her, really improve her diet and lifestyle. Then there's certain key nutritional supplements that I put people on. And then we also, kind of look at emotional, issues too, because we know that stress is, something that has a huge effect. And then what we do is I say, give me your best shot, for 3 months, take these supplements and do the best diet and lifestyle that you can. And then we re-image, and 3 months later, and so the person on the left is the same woman on the right, 3 months after she improved her diet and lifestyle and supplements. So, this is a way that allows us, as I said, to pick up these imbalances. No other test is going to pick this up. It allows us to know that we can get these, imbalances to reverse and interrupt that process of it, developing into breast cancer. And the other thing that thermal imaging is wonderful for is that because human beings are visual, the ability to see that what you're doing with all your wonderful diet and lifestyle, changes is really making a difference. So it's extremely motivating to keep people, kind of on their healthy program. So here's another example where this woman, if we're looking at symmetry, we can see that the left breast is a lot warmer than the right. The nipple's a lot warmer. And then we have this closed circular pattern, we call it, which is something that carries a lot more kind of weight or risk with it. So we did the same thing, did the healthy improvements, and then also took the dietary supplements, and 3 months later, this is how she looked. So this is ideally how I like to use thermal imaging. Will thermal imaging show breast cancer? Yes, but we have all those other tests, that will show that. And this is the only test we have that can really be used as a preventative tool. Now, on the abdomen, we see a little bit more vague patterns because, again, things are thicker, there and further away from the skin. It's normal for the belly button to look hot, and then we usually have this coolness around it because there's a little bit thicker fatty tissue in most people there. When we get digestive issues, it sometimes looks a little bit more vague, the patterns, versus what we see like in the head and neck area, for example. And so this is a person who has some digestive issues, and we're seeing these vertical patterns on either side of the abdomen. We think that those are dilated lymphatics that are associated with leaky gut. If you have kind of liver stagnation in traditional Chinese medicine, we'll actually see heat patterns kind of over the liver area. If you've got stomach issues, it'll be either in the center area, we'll see the heat patterns, or over on the left side. And then the modeling patterns that I showed you with the guy that drank the alcohol. Again, sometimes we just see those over the abdomen and know their place in the body. And that tells us, that the person is really having digestive issues that need to be improved. And again, lots of times people have no awareness, they think their digestion is great. But when we see these patterns, thermal imaging does not lie. Then I know that they need to really work on strengthening their digestion. So that's a great resource with Christine, because that's one thing that she really specializes in. So this woman did not drink alcohol, beforehand, but this is just huge systemic inflammation. And again, this is like puts people at risk for every kind of chronic disease. And again, no awareness of it. But when we see that, then we know that we really need to focus on, detoxifying and working on an anti-inflammatory kind of program. These are all the different things I kind of touched on that cause those modeling patterns. And again, I have to kind of determine by talking to the person to figure out, okay, what's the thing that makes the most sense as far as what's causing it, so we know how to reverse it. On the back, we normally see a vertical heat pattern, there, and it has to do with the contour of the back. This thermal imaging can be great for chiropractors because, again, they're kind of limited like dentists because they've got the x-rays. Where thermal imaging is going to show the condition of the soft tissues. So we get to see like how much inflammation is really going on. An x-ray won't show that. It also kind of gives us the location, and based on the configuration, it can also tell us part of the pathology, what could be going on as well. Now, the bottoms of the feet, the normal patterns are in that left side here where they're really cold. The toes are so cold you can barely see them. And then we have symmetrical heat in the instep. When we have more heat on one side versus the other, this can be an indication of plantar fasciitis. This will also show up if somebody's had an ankle injury, and even years before that time, sometimes they'll still have this kind of pattern showing up after an ankle injury. And then we'll also get different scattered patterns here that have to do with gait abnormalities. Another incredible thing that thermal imaging is able to do is in diabetics who have one of the worst complications is having a diabetic foot ulcer, and that can lead to amputation. So thermal imaging can actually see the areas that are could potentially turn into a diabetic foot ulcer, and then we're able to institute precautionary kind of measures and prevent that from happening. Now the hands, so this is what the normal hands look like. So we usually have a little bit of a heat pattern at the base of the thumb, and that has to do with increased blood flow because we're using them so much, and the fingers are nice and cold. When we have a heat pattern on one side and not the other, that could be an indication of arthritis. Then there's various conditions where the hands become abnormally warm. So when we get to a place where the whole hand is warm like this, it's called a glove pattern, and it's always associated with the blood glucose being too high. So this is giving us an indication that maybe somebody is a pre-diabetic or a diabetic that they may not even know about that. When the fingernails are abnormally hot, so red hot or white hot, that's another sign of high blood pressure. And then on the palms, we usually have some kind of mild heat patterns. If we have it on one side, not the other, that could be carpal tunnel syndrome. And then this is a very interesting pattern that we oftentimes see on people who are energy healers, so their hands are hot, from using the energy, and we see these round kind of circular, heat patterns on them. Okay, so I'm going to go ahead and close that down and stop the screen share. And then what I want to do is just talk to you a little bit about what Christine and I are working on as far as having me come up to do thermal imaging in January. So we're looking at, we decided it would be like January, what it was like 12, 13, 14. So it's a Friday, Saturday, Sunday, because we thought, it probably would be best for people to have the weekend, to come. We're still looking at a location, so we don't have that determined, quite yet. But what I need to have a significant number of people that are scheduling, because I'm living in San Diego, so it makes sense for me to come up there. So what I'm going to offer, so first of all, I'm going to show you, I'm going to screen share again and show you how to schedule on my website. And then I'm going to offer you a gift for scheduling. Let me go ahead and do the screen share again. Where are you? Screen share. Okay. And then we're going to go here and do that. Okay. So my website is it's medtherm, THERMSC.com, medtherm.com. So there's, tons of great information, on my website. I've got, videos and a lot more information if you want to, look at those. To book an appointment, what you do is you just click on book an appointment in this purple box at the top of the right page. And then that's going to take you to options. Now, normally I recommend that if you're doing your first thermal imaging, that you do either a half body or a full body. And that's because we get so much more information. As you could see, I showed you all the different things that we can see in different areas of the body. So that's what is recommended, to begin with. If you do breast thermal imaging, it's kind of a very limited information about the body. Oftentimes what we do is to do the initial, either half body, full body, and then we will determine how frequently you need to have breast thermal imaging after that. So we like to establish what's called a stable baseline in the breast. And so that may mean that maybe you need to have a follow-up depending on what we find on your initial scan. You would either follow up in 3 months or 6 months so that we can establish the stable baseline. Everybody's got, patterns in their breasts that are kind of like a fingerprint. And so we're trying to determine which of those patterns are things that we should be concerned about and which patterns are the ones that are stable that we should have no concern over. So that's important, during that first year. So let's just say, okay, we're going to do a full body thermal imaging. So I'm going to click on book, and then that's going to take me to choosing the locations. And then right now we just have Palo Alto there as we figure out, the best place. And then it's going to show us, this is December actually, because we were thinking maybe we would do that, but the calendar is going to come up like this. And then you can say, all right, I'm going to choose, 10:30. Okay. And then it takes you there, and then you start filling all this, out to register. So that's real simple, to do that, to set up. And then once you're in my system like that, I'll be sending you emails through there as far as like important information. I've got, different forms on there to download to fill out that are intake forms. There's also pre-scan instructions. And so those are really important. So in order for us to get the best imaging, there are certain things, do's and don'ts, ahead of time. So obviously I showed you the guy that drank the alcohol. You do not want to drink alcohol, ahead of time, because if we see those modeling patterns and you had alcohol to drink, then it's like, well, I don't know if it's the alcohol or I don't know if it's, something else. So at least we eliminate, that possibility. You also don't want to do any exercise in the morning because that just heats the body up, too much. And so there's, quite a few things that I have in those pre-scan instructions, for you to review so that we can make sure that we get the best, thermal imaging that we can possibly have. And then there's reminders, they'll set to you and so forth. So what I like to offer is that if you sign up and schedule for the January dates in the next 24 hours, I'm going to give you a copy of one of my books for free. That'll be included. All right, so you guys can unmute yourselves, and if anybody has any questions.
Well, I know so many people who should have been on this video. That was really an excellent presentation.
Thank
so
you.
comprehensive.
Well,
and
I recorded it, so what I'm going to do is I'm going to upload it onto YouTube, and then I will I'll send the link out to all of you. I've got your emails, and I'll send that out so that you can have other people.
I'll send it out to Creative Health Network if you forgot.
Okay, great.
Christine, I have a quick question.
Sure.
My name's Allie. So one of the reasons I'm not in love with mammograms too is the radiation that I have researched, and that the exposure to the breast during the mammogram is not great.
Yes.
Can you talk briefly about thermal imaging and like any is there any radiation or anything that to be worked?
It's just it's an infrared camera. It's just like a camera taking a picture. It is completely harmless to the body. It's radiation free. It's pain free. It's FDA approved, and it's totally safe. Even for babies. So
that's so amazing. It feels like such like a no brainer. I don't know. I loved your presentation. So thank you for.
Thank you.
Yeah.
You're welcome. Well, you can see why I'm so passionate about this. And it's like, I was, as a surgeon, I was doing a lot of breast reconstruction, and I felt like, okay, I'm on the cleanup crew, and it's
Totally.
like, this is ridiculous, like I need to be on the preventative, crew. So it's like, I don't know many people that leave their surgical practice, but I did, because I just felt like I could do so much more good for people by teaching them about how to become and stay healthy naturally and avoid the knife,
I was just talking to a younger woman today who had her first mammogram yesterday, and I didn't get to her in time. She couldn't watch this tonight, so I'm glad you're videoing it. But I was telling her, when you go to the dentist, they put this lead apron over your vital organs to protect you from, and dental x-rays are not that radiating, like to protect your organs from any random radiation. But yet when you have a mammogram,
Right.
they're compressing, they're squelching your boob, and they're sending the
I know.
radiation right through it. Like, what kind of sense does that make?
Yeah,
And she
it makes no
said,
sense.
when she was doing it, she
Yeah.
said, there's something wrong with this.
Yeah, there's something
But-
seriously wrong. Well, and if you
Yeah.
think about it logically, I mean, why would you use a test to, look for a disease, and that test actually increases the risk of the disease that is looking for? I mean, it's just crazy, so there has been a lot of research done looking at thermal imaging in relationship to breast cancer. Actually, there's 800 published studies. So it's not like this hasn't been, really well researched.
Where's the resistance? Why is this not
Because
available?
it's all
through health
money.
insurance?
It's money. It's like, our healthcare system is set up to make money. And so this is all about how can they make more money? It's not about what's logical. There was a study that came out a few years ago that actually a couple of them that were doing long-term, studies looking at people that had mammograms. So they followed women for 20 and 25 years. And so this came out, I don't know, like maybe 4 or 5 years ago or something like that. And so what they found as a conclusion, they found that mammograms cause more harm than good. Because again, they use the radiation, they overdiagnose. And as I told you, there's 80% of the biopsies are unnecessary. So there's 1 million breast biopsies done, annually. 800,000 of them are unnecessary. And I mean, the emotional upset that women go through when they have to experience of that is, like horrendous. And so Switzerland actually decided that they were going to phase out doing mammography because they felt that it was unethical to use a test that caused more harm than good. Here in the United States, they won't even talk about it. It's just like, that's what you need to do. Just get your mammogram. So they do have studies where they have looked at, okay, if you do a combination of tests, that's when you get the very best evaluation. So in addition to doing thermal imaging, so thermal imaging, again, a physiological test, not an anatomical test. If we combine it with an ultrasound, which is an anatomical test, which is completely harmless to the body, that gives us better evaluation than what we can do with a mammogram. And I always, combine with physical examination too, because it's very common for women to feel, things going on and pick things up. Yeah.
I'm sorry. I had a relative, my aunt, when she went for her mammogram, I was at her side and saw that, she got a false positive. And the physician at the Mills Breast Center who was doing the ultrasound said, just between you and me, because I was writing an article on the breast center, she said, I'm seeing more now on the ultrasound in her breast than I saw on the mammogram, and I see what there is not there. And so the stress and the damage, also as that it can actually spread something in the breast if you put a lot of pressure or whatever.
Yeah, it's crazy.
That's why I'm doing this and putting a lot of energy and effort into promoting Dr. Horner, because I've seen it in my own family, that the anguish and the pain of the wrong diagnosis, plus I've seen a lot of people get more damage from the mammograms, in terms of that.
Right. Yeah.
My biologic dentist gave a presentation to our Weston Price group, and he was citing a study. I don't know which study, and I wonder if you also are familiar with it, but he was saying that women who have had breast cancer, because all the teeth map to organs.
Yes.
I'm sure you know this. And there's a particular tooth on the left side that if you have a root canal on that tooth, all the women who've had breast cancer on the left side have a root canal on that tooth. Not everyone who has a root canal on that tooth would get breast cancer, but the other way around, those who do can be traced to a root canal on that tooth, because root canals are unhealthy. And then he was talking more about that aspect. But from the mammogram or your experience with breast cancer, I just wonder, have you experienced that as well?
Well, so I'm not a dentist, so I don't check people's mouths, but definitely I've seen that research. There's definitely association, with it. So, yeah.
This is really great. You were super.
Great. So, any other questions that anybody has? Yes,
I have a question.
Karen.
So you mentioned, but I'm a little unclear. You mentioned that if you see something if you come in for an initial thermography and say you do a full body.
Yes.
How often, and if you're, assume that you're living a healthy lifestyle, you're eating clean and you're exercising and you're caring for yourself. How frequently should you do the thermography?
Okay. So one thing I failed to mention was that, another thing that's really kind of unique, about me doing thermal imaging is that most thermographers are people who are not even in the medical profession. They're just taking the picture. They're like a technician. But for me, it's like I do the images, I do the interpretation of the images and, prepare your report. And then included, in doing your thermal imaging is that after we do that, I will meet you on Zoom and I'm going to go over all of your different, the findings that we have. And because I'm an expert in natural health, too, I then give coaching, for you about things that I would recommend. So, there are things where it's like, okay, you need to go to your dentist, because we're seeing these things, but other kinds of patterns that we see, I really try to work holistically. And so I give recommendations of different kinds of techniques or practitioners, that you could see that would help you with, whatever we're seeing. So that's all included, so that's
wonderful.
Health coaching with that too. Now, the follow-up, normally we say, all right, once a year, we'll just say a baseline, we do thermal imaging, once a year. Now, the very first time that you have thermal imaging, we're looking also at, what's going on with the breast, in particular. So if we have any findings in them, we want to re-image in about 3 months. And if there's no findings, we do 6 months. And again, we're trying to establish, if these patterns are things to be concerned about or not. I mean, some women have, scary looking patterns in their breasts, but they looked exactly the same year after year after year.
Right.
Change. And that way we know, okay, these are stable patterns and it's not something for us to be concerned about. In the first year, while we're trying to establish a stable pattern, it's all based on the number of findings, that we're seeing. So it's going to be 3 to 6 months, as far as follow-up. Once we establish a stable baseline, then it's yearly. And then again, I recommend doing an ultrasound once a year, in conjunction with that, so that we have an anatomical test, too.
So the full body once a year, and the
Some
breast
people, some people choose to do that. Yeah. I mean, it's kind of a great thing, to be able to check in and see what your overall health is doing. So usually I recommend if you can, half body to a full body yearly.
Okay.
And then we'll do, maybe more frequent thermal imaging of the breast if, there's something that, we're concerned about or we want to, monitor more closely.
Okay.
Yeah, and the other thing is like the breast will change really rapidly, so as I showed you in 3 months, I mean, to me, that's incredible to see that kind of reversal, in 3 months of the patterns in the breast. Whereas the rest of the body, kind of interestingly, like thermographically, it changes more slowly. So like I never do, repeats of the rest of the body within, 3 months, maybe 6 months, but yeah, because it just changes.
But a year is
a year,
also reasonable.
Yeah, a year is a really good,
Okay.
thing to do. Unless, the only other reason is like if there's something going on where, let's say they have severe digestive issues, Christine is working with you. We want to take a look at the abdomen to see if those patterns have cleared up. Then we would look at 6 months,
Okay.
Uh-huh.
Okay.
Your skill set is just amazing that you are able to combine Ayurveda and nutrition and this, and plus your traditional medical
Yes.
training. That's
Yeah.
I don't know anybody else who
I
is
don't either.
cross-trained like you.
Yeah.
It's great.
Great. You're really getting your gifts. You're using your gifts and you're sharing them.
I am trying. Yeah. All right, I'm going to go ahead and stop the recording then.